Hello everyone, I'm Jana, a patient consultation expert at the height reduction team. In today's video, I'd like to briefly discuss when limb shortening patients can return to their normal walking routines. When can patients walk without support after limb shortening surgery? After the surgery, patients typically use a walker and a wheelchair with support for about 1 to 1.5 months. The initial 2 months involve intensive rehabilitation, closely monitored by both physical therapists and a doctor. Towards the end of the 2nd month, an X-ray is taken and reviewed by the doctor. If the bone healing is going well, the range of motion is good, and the muscle imbalance has significantly decreased, patients are allowed to transition to using crutches with the doctor's approval. The use of the crutches typically continues for about 1 to 2 months. Patients are advised to carry on with physical therapy and exercises for approximately 5 to 6 months. They usually achieve partial independence and walk without support around 2 to 4 months after the surgery. It is natural to have a penguin walk during the transition from supported to unsupported walking. Time is given for the legs to adapt to the achieved shortening. The more patients adhere to the exercise and rehabilitation, the faster this adjustment takes place and eventually they regain their normal walking. Regular follow-up X-rays, rehabilitation, exercises, and updates on the patient's condition are crucial during the first 6 months. When do limb shortening patients regain their normal walking? After the surgery, muscle accumulation occurs in the area where the bone was shortened, leading to a condition known as muscle imbalance. This is the most visible side effect post-surgery, and if proper rehabilitation is not received, it can be a significant complication. If the above-mentioned points are abided by in the first 6 months, patients regain their normal gait on average 5 to 8 months after the surgery. Of course, factors such as the amount of reduction, bone healing, the recovery process, physical therapy, and similar factors can both shorten or prolong this timeline. What are the current conditions of our 3 limb shortening patients? Unfortunately, we lost contact with our first patient. We couldn't maintain continuous communication with that patient as we did with the other 2 patients. The last 2 patients underwent surgery a month apart and are currently living semi-independently. The patient who had 4.8 centimeters femur shortening still has partial muscle imbalance and continues to receive physical therapy. Overall, his condition is good and he has not experienced any major complications. Besides, a return to his physical job is expected soon. The patient with a 4.1 centimeters femur shortening does not currently have a muscle imbalance and has returned to her normal life and has not experienced any major complications. Both of them are very close to achieving their normal walking routines. Finally, our doctor advises limb shortening patients to stay here for a minimum of 2 months and ideally up to 3 months if possible. This allows for close monitoring of their physical condition and ensures proper rehabilitation. Well, that's it for now. If you have any more questions or if you'd like to ask to create content on a topic you're curious about, please leave a comment below. Have a great rest of the day.